Hey, this is Amy Applegate giving report on Miss Lucy Gray, 75-year-old female. She reports near syncope. She reported to the ER today. She had a fall without any major injury. Her background is she has a history of once a month reporting to the emergency room for near syncope and falls without any injuries and no physiological findings to cause this. She lost her spouse recently. She's reporting feelings of loneliness and despair. She has a history of a right total knee replacement, and she has not taken her Celebrex today. Her blood pressure was elevated at 166/88. Heart rate was slightly elevated at 102. O2 sat was normal. We applied some oxygen for comfort. She's alert and oriented ×3. She did not take any medications today, thinking that the hypertension may be due to anxiety. She has normal range of motion with some stiffness, but she's got osteoarthritis and did not take her Celebrex. She has a mild abrasion to her forearm, and she's got a hep lock in her right forearm. And my recommendation would be to address the anxiety, address the abrasion, and plan a psych consult as well as a social work consult to assist with socialization. As far as the initial assessment, Lucy's strengths would be she doesn't have a lot of comorbidities. She's also self-aware of, her anxiety and sadness due to her partner's loss. She's willing to receive help. My concerns for her are that she's depressed and anxious and isolates herself somewhat. She's having difficulty adjusting to the situation that she's in. I'm concerned because she keeps coming to the emergency room rather than going to see her primary or maybe a counselor. It would be helpful if we could get an EKG and some labs, possibly imaging results to, further rule out any physiological causes of the syncope. My priority concerns would be to rule those things out, rule out cardiac, electrolyte imbalance, neurological, and then we would address the psychological concerns that seem to be causing the physical concerns. My solutions for this would be to consider a social work consult as well as a psych consult. Social work to help with, gathering resources for socialization. Possibly physical therapy for balance. And if I were to be talking to Lucy, I would say, I'm concerned that you're not getting the help you need because you've been seen in the emergency room 3 times now, and we haven't really found any physical cause for your symptoms. So, would you be willing to talk to somebody about how you're feeling about your partner's passing? And then the actions I would take would be to initiate a social work consult and discuss the process with the patient, provide follow-up information, such as, how to contact the clinic to set up an appointment. and follow up with her with any results of labs or imaging that she had while she was in the emergency room. Thanks. Have a good day.